Good morning, everyone. Happy Monday. And we're live doing another talk on anxiety and depression and the holidays. And so I'd like to continue with the discussion from last week. And, again, the disclaimer is that if you're diagnosed with anxiety and depression or variations of these kinds of mental health issues, definitely seek appropriate authoritative support. This talk is meant more for the general sense of the person that happens to suffer from or struggle with anxiety and depression that occurs normally this time of year. And then in many people, because of COVID circumstances, that's also brought out the anxiety and depression in people. So it's unsurprising that it will be magnified this time of year because naturally this time of year is when anxiety and depression can occur more obviously. Some people suffer from or struggle with seasonal affective disorder, and that falls into this category as well in general. And so, as I mentioned last week, some general considerations. Another disclaimer is that as a professional of Ayurveda, as Dr. Ayurveda, um, it's unethical for me to say, take this herb, because this is the magic herb that's going to resolve the anxiety or depression. The traditional and properly practiced understanding of Ayurveda is not a one size fits all, and that it requires an individualized approach, assessment, and protocol to put in place for each individual to understand what the root cause of that person's anxiety, depression, and other things. Um, Understanding what the root cause is for that person. There are general qualities, characteristics, lakshanas, as it's known in Ayurveda, that can determine, which category a person falls into because of just basic connection to certain qualities. Um, Again, I can't diagnose to the degree of Western medicine, but from the Ayurvedic perspective, we can discuss anxiety and depression and other things like that and address it accordingly per individual. So it's not ethical practice to say, take these herbs because these herbs are great for anxiety and depression and the such. Um, because the reality is we don't know. There are herbs that are amazing for such types of mental health ailments or physical ailments, but it doesn't guarantee it's going to work in your own physiology and psychology. And so it's understanding the importance of seeing and seeking an authority in this profession, at least of Ayurveda, to understand what is the right herb formula, compounds, and other recommendations. There's no one size fits all when it comes to any of it. I can mention things like vitamin B complex helps to manage the mind and stress, and it's an adaptogen. Vitamin D is great as well, especially during a season where seasonal affective disorder is common and seems to occur as a result of low vitamin D levels, things like that. Light therapy as well are some things that have been studied and continue to be studied to see how um, the approach of light therapy can actually be fully successful. There are plenty of herbs like ashwagandha, which is very famous and in a lot of formulas today. But most often than not, when I meet with an individual, they say they found ashwagandha through some commercial. In many cases, that person cannot take the ashwagandha because it's not appropriate for them. It's not going to affect them in the same way that the studies have shown each herb to successfully work as, because we are individualized in physiology. Ayurveda discusses the doshas, and we have to understand the importance of the application because if a person is really experiencing digestive issues, then for the most part, taking any kind of herb or supplement or numerous herbs and supplements is actually contraindicated. It's better to be simplified and simplistic when there's a complexity of issues than it is to meet complexity with complexity. Has to be done properly, phase one by phase two, level one by level two, layer by layer. It's not a quick gunshot approach or shotgun approach. And, this is what has to be considered. Everyone's looking for that quick fix or that one magic pill, that one magic herb, that one magic thing to do, and there's no such thing. It's the right circumstances cultivated within a certain context in a scientific way within a protocol for each individual. I'm sorry to say, but this is how things are done more properly, and properly representing Ayurveda. It's important for me to express this. Simplified things that we can do for many people where it's practical, that contributes towards depression and anxiety is, for depression, don't overeat. If you're overeating, then you're creating more heaviness in your body, which is going to match the heaviness that might be occurring in your mind. And if you're feeling that nostalgic type of depression, like I mentioned last week, discerning between an anxiety-provoked depression and a true depression, a lethargic type of depression, nostalgic type of depression, then there's a different recommendation for each quality. It's about the appropriate assessment. But in general, overeating is not proper. The body starts to just, hunker down and get weighed down. And then, of course, eventually these, food particulates make their way into the blood channels, the arteries, the veins, and etc., and the lymphatic system. And then the body just starts to feel, what people say, oh, I feel so toxic, which it's a whole other discussion to use the word toxin. So, for the purposes of this, knowing that there's unprocessed, undigested waste materials accumulating in the body in inappropriate places, it requires proper treatments to reverse this. And we start with digestion. And so understanding when these things are applied. But in general, the rule of thumb is don't overeat. Don't oversleep. Don't sleep during the daytime. Don't stay up late. Staying up late increases anxiety, which affects metabolism the next day. And so people either have increased cravings for sugary substances or caffeinated substances. Anxiety does increase, especially in those prone to anxiety, by staying up late. There's a dryness factor. There's an inflammatory factor that occurs when you stay up later and later past 10 o'clock. It's cause and effect. This is what Ayurveda has been saying for thousands of years. And, if you're not sure, test it out for yourself. Take about 2 weeks, maybe 3 weeks, if not at least a week, to get to sleep by 10, not in bed by 10. That's very specific. Bed time and sleep time, two different things. And test it out. See what you feel like. It's more important to get to sleep at a certain time than it is what time you wake up, unless, of course, you wake up in the middle of the night, and that suggests some other types of pathologies that might be forming. And then waking up around 6 o'clock in the morning and starting your day out with proper practices of hygiene and exercise, and then showering or bathing, and then breakfast, and then starting your work day, etc. Get into alignment with the times of the day, the times of the year, the seasons. Understanding what's important, for you, and watching the food, watching the sleep intake, watching what you're doing with exercise. If you're not exercising, then how do you expect to feel vital? The body is required to have movement, not just lifting up bags and boxes, but all the full directions of spinal mobility and just different kinds of mobility of the whole body. Yoga is the top, physical regimen in the context of Ayurvedic perspective for this. And then other sort of like cross training or physical training, things like that, which is more specific to the body itself. Yoga will enhance and magnify the benefits of any other physical activity that you do. Also incorporate massage. Massage is not just a luxurious tool, but it's also a fundamental medicine, because it requires you to just relax, and you get to relax after at least many treatments. Some people aren't necessarily relaxing the first session or the first 10 minutes of a session, but with repeated exposure to physical contact through someone else that's doing it with warm oils and things like that, the body will start to release things that it's been holding on to, which will make the exercise practice, the yoga practice, much better, and you'll actually have even better sleep. There's so much scientific knowledge on the body of massage therapies, and Ayurveda offers so many amazing different types of therapies that are implemented within the context of a protocol to really support optimal well-being. So as far as, wrapping up this talk, just notice the little things. If you're interested in really working on anxiety and depression and understand what the version is within your context, in your life, notice within the context of your life what choices are you making that are adding to either increasing anxiety and depression or decreasing anxiety and depression and everything else, and also noticing cause and effect in your life. You are in charge of your life. You are in charge because you are the center of your universe within your world. Everything starts with you. And so when you reconnect with yourself, then you can find out like what's really needed and allow yourself to come back into a state of homeostasis or balance and be content and know that the tendencies during certain times of year might produce certain types of emotional states, and now you're more in charge of that to know what you need to put in place to help remediate that. And I will probably continue this talk next week. I'm going to end on that note right now. I'm always taking on patients. I love working with new people, and it's an adventure and it's a journey. My long-standing patients have been thriving and doing amazingly through the COVID and doing amazing through the seasons and just their health, and just it's a beautiful experience for me to observe and to be part of and to share in their journey of health and well-being by offering all these amazing, profound teachings of Ayurveda. I'll leave my link in the comment section below. Remember that I do my yoga classes twice a week, Tuesdays and Fridays Eastern Time, and I'm always happy to be of service to the community, and telehealth sessions are always available. So telehealth, in person, whatever's possible, whatever you can do, just start today. Your life depends on it in so many amazing ways, and it will thank you in so many ways. Have a great day. Happy Monday.